The Indonesian Health Ministry has started to roll out a second booster shot strictly for health workers. This started on July the 29th over concerns of the new Omicron subvariants. What is your take on this?
This is very important and right decision because it is important to keep our COVID-19 vaccination up to date, which means having all boosters we are eligible for is very important. So getting booster will provide an extra layers of protection against COVID-19. And research indicate that the risk of reinfection and also hospitalization are lower if a person or community who has had COVID-19 has also been vaccinated. And of course, for the total community, it's very important to have this. I mean, at finally, at the end, they have to also have this booster. But now we have to prioritize our very important population group or the high risk group, which is based on their occupation or based on their body condition, which is like elderly or healthcare workers. So because then again by getting this booster, the risk is further reduced with each additional dose of vaccine, including booster, the fourth dose
So,
of
uh,
vaccine COVID.
But Dicky, I'm wondering because we have reported on slightly lower numbers than we expected of first booster shots in the general public, so people are still being encouraged to get them. And now the or the second booster or the fourth shot is being rolled out to healthcare. Do you think that's going to be a problem if more and more people haven't gotten their first boosters yet, and then we start to see kind of a gap between those that have gotten their second boosters and those that are still trying to catch up? And is this the reason why elders and those with comorbidities are not yet included in the second booster shot group?
Yeah, the problem is that we are now facing the how can I say, the peak of the COVID-19 wave,
Okay.
the fourth wave of COVID-19, and during before that the time is come, we have to protect the most vulnerable ones in community, which is the like elderly and also the healthcare workers.
Okay.
So we cannot wait to protect them because we don't want to see during this, let's say, vaccination for the second dose or the third dose, but then many people have to go to ICU or hospital, and
Right.
also some people will die because of we forgot to protect them by giving them the fourth dose. So this is something that we have to do in the same time. So
Right.
that's why I also remind the government this is their homework. This is their homework from the earlier term or the maybe 3 or 4 months ago. They have to achieve the goal to coverage the second dose, the third dose before the next wave.
Right.
So we have to take a lesson learned from this. We cannot wait our duty to cover or achieve the vaccination coverage until the next wave, because this is not also the last wave that we will face during this pandemic.
Gotcha.
Now, speaking about learning from past experience, we'd like to also talk to you about the monkeypox. Now, according to the WHO, 75 countries and territories worldwide have reported infections with a total about 16,000 cases. Well, Indonesia so far is out of that list, but of course, we cannot afford to turn a blind eye to this alarming situation. So, Pak Dicky, what can we learn from our COVID-19 response in dealing with the possible monkeypox entering the country?
The very important message first, I always raise this statement that endemic state of the disease, especially the communicable disease, is not good. It's not well staged. It's very dangerous because then it's we cannot predict. Maybe 1 year or 2 years later, it's become epidemic. Then maybe become a pandemic in the last stage. So again, the goals or the goals or the aims to control the disease is not to achieve the endemic state of the disease. That's completely wrong, completely dangerous. That's the very strong message from the monkeypox. And again, if we apply this to COVID-19, again, then we cannot put the our strategy to deal with the COVID-19 to put them as the endemic stage. So we have to prevent the next transmission and put this as the manageable or control the disease. And of course, monkeypox and COVID-19 are different in many ways, but because the way they transmit and COVID-19 is easier to transmit through the air, or we call it the airborne disease. But monkeypox and COVID-19 has similar also lesson learned. First, that there's some crucial lesson learned from the COVID-19 pandemic, such as the importance of rapid responses, early detection, sharing information, building trust and transparency and risk communication, leadership. That's very a lot of lesson learned that we can get from the COVID-19. And also the last one is preventing stigma, because for monkeypox, the stigma is rise now. It's because some people say, "I'm not gay, I will not get this monkeypox." No, that's not true. If you look at the endemic state of this monkeypox in Africa, it can spread among the community, from childhood until elderly, from male to female, from doctor to ordinary person. So this is a communicable disease. Communicable disease is in community, not in specific population group. And the last piece is very crucial. The lesson learned from COVID-19 to monkeypox is that all the lesson COVID-19 has taught teach us is one of the biggest is that a threat to one part of the globe is the threat to all. That's very important. So we have to collaborate to deal with any kind of pandemic, epidemic, or an endemic disease. That's something that's easy to say, but again, as the previous session, you guys talk with the young generation about the G20, and
Right.
that's very important. That's very important.
Yeah, Pak Dicky, I totally agree with you, because a lot of people feel, oh, if I'm not at high risk, then I'm not at risk, which is absolutely not true. And another thing is we've
Yes.
seen it spreading in a country like Africa, where it's very hot there and you probably wear less clothing.
Yeah.
Well, in Indonesia, it's also very hot all year round, and you're not likely to have coats and layers of clothing. So skin-to-skin contact can happen in a lot of cases. Now, one of the things that we worry about is that mobility plays a big part in these viruses spreading these days, Pak Dicky. And there is a possibility that monkeypox may be here and may be undetected. So what should the strategy be in this? You mentioned about quick response. Should there be a strategy in place, or is there already currently a contingency plan in place if and when that happens?
Yeah. Again, one lesson learned from the COVID-19 is that it is widely acknowledged the disease like, let's say, COVID-19 or even monkeypox, who has almost 3 weeks incubation phase, can be spread around the globe, because this person can enter one country or one region without detect we can detect this person, because the virus inside his body or her body, but we cannot detect because this long incubation period.
Right.
So that's why we can now we see many cases around the globe, including very big possibility in Indonesia. Because why? The cluster who spread or become the let's say the zero case for the global monkeypox, this epidemic, it's from the certain group. We know this gay, bisexual, and also this commercial sex workers group, which is that's unfortunate for them. But the population, this specific population, has also, the network in many countries. The similar behavior also has also in many countries, including Indonesia. So if we can see the risk is there, the behavior risk is there, So we can estimate, okay, that's a possibility. And also because this mobilization, you Paul mentioned about mobilization. Look, of course, this globalization is, even before during pandemic we limit these activities, but now the mobilization, the interaction among people is increasing close to the normal era before pandemic. So that's now we can see that the case is around here. But again, it doesn't mean it's many, but at least one or two or three, but it's there. So again, early detection is important. And also we have to reduce the stigma, because if we put this stigma for this certain population, they will cover themselves. They will hide, and that's dangerous.
Right.
That's dangerous. So
Ah.
we have to raise the awareness among community that this is a problem for all of us,
Yeah.
Yeah.
and we have to again collaborate and cooperate to prevent more transmission, because again many many Indonesian has this behavior, Paul and Marisa, even during COVID and now during monkeypox, especially during within this certain population. When they sick, they stay at home. When they sick, they try to treat by themselves.
Yeah.
Especially this stigma. They want, they, of course, they don't want to show this to maybe to their family or
True.
of course to
Yeah.
the community. So this is that the government should do the community outreach, the
Right.
risk communication, to build the awareness and also self awareness, and also prevent the stigma. It's very important for
I
this
think
monkeypox.
that is such an important point, by the way, because if we think back early COVID-19 days,
Yeah.
people were ashamed. It was like, oh, I better not tell anyone I have COVID
maybe
because I'll be
because they
outed
were-
by the community.
That's the thing. Maybe
right?
because they would be outed by the community instead of, like give us
Embraced.
giving empathy
Right.
to them and feeling sorry for them. The fact that they're sick, we shame them, which
Yeah.
is not good.
Yeah.
We
It took
don't
time
do
for that to change, and it certainly has
Exactly.
now, but it took time.
It took time.
Yeah.
Well, as you said, Pak Dicky, I mean, there is this possibility that monkeypox is going to enter Indonesia, is probably already here. Do we have enough health
Yeah.
infrastructure to make sure that this doesn't go out of control if it happens?
Yeah, this is not easy to answer, because again, the answer is depend on how we can reach these most vulnerable ones,
Oh, okay.
how we can give access to the most needed one among this population to the treatment and vaccine, and how strong our surveillance system, not only among these risk population group, but also in healthcare facilities, because we have also to monitor in general population about these symptom, I mean this disease, and this surveillance system also should be strengthened. And frankly speaking, I'm a little bit worried about this, because during COVID-19, our surveillance system is not really strengthened enough, and then monkeypox come during this situation,
Yeah.
and we have the hepatitis and many. So again, this is something that we have to fix from now on, because we have to act now, because otherwise another threat will come and we do nothing to improve our health system.
Right.
So again, even last night I discussed with the government. I told them that we have, even for vaccine, we have to prepare from now on. Not necessarily many, but at least we have the what to say this the some numbers of vaccine. When we find the first cluster of this monkeypox
Yeah.
among community, then we will have to, because we have to do this ring vaccination strategy.
Yes.
When we found this new the first cluster, that's to prevent more transmission.
Okay. Pak Dicky, real quick, I know you have pressed for time, but in regards to vaccination, we have heard that smallpox vaccinations are somewhat effective against monkeypox as well. Do we have, or are we somewhat prepared then, if we do have stocks of smallpox vaccine in Indonesia, to at least start being prepared for this?
Yeah, very small number, and not mentioned in Indonesia only, but even USA, who has the higher number of this monkeypox, the lack of this vaccine and storage. So that's the global issue for this monkeypox strategy now is about the vaccine numbers,
Right.
because again the very expensive and valuable lesson learned from the COVID-19 is about, and I mean from the monkeypox, is that the endemic stage of this monkeypox has been put with, I mean, Africa in long years, you know, not get help, and also very lack of research,
Yeah.
especially for vaccine, and also then again the number of vaccine is not well distributed now. So it takes a time to have to get this vaccine, but the government should try to do their best to get the vaccine, otherwise we will not have enough tools, weapon to deal with I mean the monkeypox.
Right.
But at least for a while now, temporary, we do our best by doing we call it non-pharmaceutical intervention, healthy behavior, personal hygiene, the even wearing masks, washing hand frequently. That's what we have to do now, and also the healthy lifestyle is including healthy sex style.
Yeah.
I mean,
Sex life.
Well,
because
be responsible, right? Yes.
Yes.
Yeah.
yeah. That's very important.
Okay. Thank you so much, Padiki, for your time. We really do appreciate this latest
Thank you.
update. It's been great to check in with you again, and we hope to talk to you again real soon. Stay healthy.
Thank you, Pa.
Thanks
Have a
for
lovely
all the advice.
day.
Take
Bye.
care.